Desde muy chico me echan los vicios, todo lo malo conozco yo. Conozco a todos los traficantes y criminales de la región. Desde las sierras allá en Chihuahua, con carga blanca viajaba yo. Y entre las barbas de los queribes cruzaba aduanas de inmigración. Cargas enteras de hierba buena llevé a Chicago y a Nueva York. Y varias veces por mala suerte caí en la celda de la prisión. Allá en Laredo, en una emboscada, con los queribes me la rifé. Me fui por Alice, tirando al norte, ni de la muerte yo me acordé. Por San Antonio pasé de noche, llegando a Houston no sé por qué. Los patrulleros tenían aviso y del corral me les escapé. Terrible cárcel de Kansas City, famosa cárcel de San Quintín. De San Antonio, su cárcel nueva, del quinto piso me le salí. El gato negro no se despide, desaparece de la región. Cuando me miren todo de negro, de ojos borrados, ese soy yo.
Running out of teardrops, running out of heartaches, sick and tired of your lies, excusing what you do. angel says she'd bet her wings for sure.
Well,
sunshine, but you just won't leave it alone. And I got a right to be wrong. Sleep don't overtake me here, don't run me down like this. I got miles before they're gonna lay me down, and I ain't ready yet, no, I ain't there yet. The Quaalude Highway hypnotizing, the lines across my face. But one more sign before my mind begins to hallucinate and can't stay awake. So give me something strong, let the night roll on today. Unsleeping night, so don't you fail me now. Crack a window wide and put your right foot down. So daydream through the night, but keep them wheels a spinning round and round. Unsleeping night, now don't you fail me now. Oh, there's a girl at home, she waiting up till dawn. Lord, she could use some sleep. I flash my brights and I dim my lights. I sink down a little deeper into my seat. Yeah, just to get back home, this old Rolling Stone gone 1,000 miles a night. To grant me speed and eyes to see my lonely girl tonight, she's so out of sight. Lord, don't make me sleep like a refugee, it ain't right. The unsleeping night, don't you fail me now. Crack a window wide and put your right foot down. So daydream through the night and keep them wheels spinning round. Unsleeping night, say don't you fail me, say don't you fail me. Blacktop asphalt, the grooving past all the rhythm in the lines. I'm locked down deep into the pocket, the sunrise keeping my time. So all I ask is a tank of gas and a cup of coffee strong. And a highway moon are gonna keep me moving. I'm driving all night long, unsleeping night. Don't you fail me now. Crack a window wide and put your right foot down. Today through the night, but keep them wheels spinning round and round. Unsleeping night, say don't you fail me now. Unsleeping night, hey, say don't you fail me now.
was leaning long-legged neath the bottle cap sign of the country store with a Coke and a smile. Coolest place to linger on an Arkansas day when she saw him passing by. He said, I'll take you back to Texas and my name is Ray, where the stars are bigger than the hit parade. And she stopped dreaming her dream and started dreaming his, traded in her childhood. And she wore flower dresses for him, rolled her hair and scrubbed her freckled skin, on the chance that they were going out tonight, catch a show, maybe grab a bite. And she looked real nice, she looked real nice. Sometimes I think about my daddy and his old Spice grin, clean pressed shirt and a farmer's tan. She never asked him questions and he never told her lies, but I heard my mama cry some. I was sitting in the hallway on the night he left, hugging my knees, holding my breath. I was never sure why, but he was damn sure gone. Thought it was maybe my fault. She wore flower dresses for him, rolled her hair and scrubbed her freckled skin, on the chance that they were going out tonight.
Good morning, everyone. I'm Sydney Benter with Austin Public Health. We appreciate you joining us for today's media Q&A. Spanish interpretation is available, as always, on ATXN3. First, we're going to hear remarks today from Dr. Desmar Walks, Austin Travis County Health Authority, followed by our guest today, Dr. Sarmistha Hauger, Pediatric Infectious Disease Specialist at Dell Children's Medical Center and Associate Professor at Dell Medical School at the University of Texas at Austin. Then we're going to hear from Janet Pichette, Austin Public Health Chief Epidemiologist, and Cassandra De Leon, Austin Public Health Administrative Officer for Disease Prevention and Health Promotion Division. Finally, Adrienne Stirrup, Director of Austin Public Health. Let's begin with Dr. Walks.
Good morning, Austin Travis County. We are here today to give you an update on the situation in our community, and we have good news. Our efforts to curb the spread of COVID-19 have been effective. We're starting to see our case numbers go down. We are really encouraged by that, and we need to redouble our efforts to do what we know to stop that spread with masking and vaccinations and staying up to date on those vaccines, because there have been early reports of the emergence and arrival in Texas of the sublineage of the variant Omicron in Texas. The new variant is one that spreads quickly, more quickly than the BA1 subvariant that we have currently predominantly in our community. It is, however, being attacked by those vaccine antibodies that we have in our toolbox. So the vaccines we have are working against it, and it does appear to also produce mild disease, but it is important that we don't let our guard down, that we continue to do battle with this. We're seeing large numbers of pediatric cases in our community, with 91% of those children who are admitted unvaccinated to our hospitals. And for that reason, today we've asked Dr. Sarmistha Hauger to join us to give us an update on what's happening in our pediatric hospitals. And with that, I'll pass it on to Dr. Hauger.
Thank you so much, Dr. Walks. Hi, I'm Sarmistha Hauger. I'm a pediatric infectious disease physician. I've practiced in Austin for a long time, 25 years or so. I'm here today to talk to you about what we've seen with this particular surge and COVID in our children. As you all know, over 9 million children have tested positive for COVID since the pandemic began nationwide. And importantly, since January, about 900,000 have tested positive. Still a small amount that are hospitalized, but it has increased. In January, I think nationwide, the statistics are about children account for about 2.9% of all hospitalizations. We have felt it in our hospital. Since the pandemic began, we've taken care of over 300 children that have been admitted with COVID and are positive and symptomatic. Since January, when this Omicron surge occurred, we've exceeded how many admissions we had since in the summer with Delta, when we had the Delta surge. The important changes that we've seen are there are a lot more younger children being admitted. So about almost 37% or so of our children that are admitted since January have fallen into that younger age group, 0 to 4. This is a big change for us, seeing with the previous surges with first Alpha and Delta, which were mostly teenagers or above 12. The other thing that we have seen, and Dr. Walks is right, vast majority of these children are unvaccinated and their families are unvaccinated. The children that are ill and are vaccinated or have some vaccine usually have an immune problem that can't mount an antibody response to the virus. So people that are healthy, the children that are healthy that are getting admitted are almost all unvaccinated. About a fifth of our children have required intensive care. What that means is that they are so low in oxygen that they require excess oxygen to be delivered in ways to keep their oxygen levels normal. So that is how that has been different. The other thing I want to mention through the pandemic is in pediatrics, something that is a bit unique to pediatrics is we have seen a case, a syndrome called MIS-C, which is a multi-inflammatory systemic response after COVID, usually happens 2 to 6 weeks after COVID. And we had seen this with Delta affecting, and those children really do come in very ill. About half of them require critical care. It's an inflammatory response, especially we worry about the heart. And those children just don't present unless they're infected with COVID or have a history of infection with COVID. The vast majority of them also are unvaccinated. We have not started to see that yet in the rates that we were seeing it in the summer, but it is a bit early. We're expecting that to happen soon. We'll keep our, we'll keep our eyes and ears open for that. So again, the differences that we have seen with Omicron really are the excess number of children getting admitted with symptoms and the younger age group and the unvaccinated. The vast majority are unvaccinated. And with that, I'll turn it over to Jan Bichette. I think she has some epidemiologic things to say. Thank you.
Thank you, and good morning, everyone. So as we've heard, I think there is some positive news on our front for Austin and Travis County. Our data indicates that we have reached a plateau and we are on the downward slide of an initial Omicron peak. And what we're seeing based on our data indicates, we're seeing decreases in the number of positive lab reports that are being reported to us on a daily basis. Just last week, we received over 22,000 positive lab results at Austin Public Health. And this week we received only 15,000. So that's a huge difference and represents a 31% decrease in the number of labs being reported into the health department. We're also seeing decreases in our demand for certain services, such as testing operations. We still offer testing at 2 locations at the George Morales Recreation Center or the Dove Springs Recreation Center located at 5801 Inez in Southeast Austin, and that operation is open Tuesday through Saturday from 8 a.m. to 2 p.m. And we're also have testing operations at the Travis County Exposition Center that continue at their 7311 Decker Lane. And those operations are open from 8 a.m. to 2 p.m. Monday through Friday. You can register for an appointment, or you can walk up or drive up if you haven't had an appointment. If you have any difficulty making arrangements for an appointment, you can call our nurse hotline at 512-972-5560, and they can help make arrangements to either register you for testing. But the main thing is, if you are suffering from symptoms that are COVID-like in nature, you need to remember, to get tested if you can. If you cannot get tested, you need to make sure that you're isolating at home and not exposing other people in your family to that symptomology. So again, we are seeing, because of Omicron, our numbers are coming down, but they're still pretty high if you look at community transmission rates. So we still need to be doing those things to keep us protected. And I think one of the number one things is to get vaccinated, as you just heard from the doctor, both doctors, that it is affecting many people who are unvaccinated. So now's the time to get vaccinated and to get up to date on your booster and other vaccinations to provide that added protection. And with that, I'll turn it over to Cassie DeLeon for comments.
Thank you, Janet, and good morning. We've talked a lot this morning already about vaccine. I just want to also congratulate our community on the great work that we've done already to get over 71% of our eligible population, those that are 5 years old and older, fully vaccinated. That's a huge accomplishment, and that's really protecting so many people. So that's a huge accomplishment. And so thank you for the commitment to protecting yourself and protecting your neighbors and family and the rest of the community. But we still know, even with 71% of the community fully vaccinated, we still have a lot of those that could still get vaccinated that haven't had even that one dose. Over 200,000 eligible individuals have yet to even get one dose. And so we really want to make sure that people are aware that the vaccine is still available. It is free, and you don't need insurance, and you don't need to show ID if you come to Austin Public Health to get the vaccine. So we really want to encourage folks to take advantage of the opportunity where vaccines available in many, many spaces and places for you to get that vaccine so you can protect yourself, protect your family, and protect everyone that you may encounter in the community. We also know it's important to think about those that are under 5, those 4-year-olds and newborns that can't get vaccinated. They are completely vulnerable to this virus. And so if we, as a community, at least get as many people who can get the vaccine vaccinated, that offers some protection that we likely can protect them from having to contract this disease. We've got some work to do still, and I know that we can do it. So we'll continue to offer, Austin Public Health will continue to offer the vaccine, continue to be available, and we just want to continue to encourage everyone to work towards getting everyone protected as we have throughout the entire pandemic. And with that, I'll pass it over to Adrienne.
Thank you, Cassie. You're right. We've done a lot of good work, but there's still so much more to do. And that's where we begin to look at the impact of this virus from a health equity perspective. We know that chronic disease impacts the way that our bodies are able to fight off COVID-19. And we also know in Austin and Travis County that there are, in our African American and Latinx communities, those populations are more at risk for severe disease or death due to chronic disease. And so we know the intersection between that and COVID-19 is very important. And so not only are we encouraging communities to get vaccines, we're supporting them as well. And Cassie touched on that in her remarks, making sure that we are in places and spaces to make it easy for someone to get a vaccine, We're free. There are no appointments required. And most recently on the city council agenda, an item was passed to approve the purchase of gift cards. And I want to be clear, these are not incentives or rewards for people doing the right thing. These are supports. There are many people in our community that don't have the luxury of being able to take off work to come and do the right thing and keep themselves and their families safe. And so that gift card provides a little relief for the time you took off from work. There's not a gap in what you're able to provide for your family. And so that is a very important tool that we will continue to use to support our communities that need us the most. We are so appreciative of our business community standing up and protecting not only their workers and employees, but our community as well. And I am confident that if we just keep on this course, that we will be able to come out of this. And with that, I open us up for questions.
Yeah, so our pool reporter today is Claire Shoup from Community Impact. She's going to ask questions on behalf of the news outlets. Claire.
Hi, thank you all so much. The first question today is, are statistics available for the number of children in the Austin-Travis County area who have been vaccinated? And what are the latest booster shot recommendations for children 5 to 12?
I'll start. So we know that over 94,000 children that are within that eligible population. And to note, that's between the 5 to 15-year-old population have received at least a first dose. And so we're excited to know that they've at least received some layer of protection. Regarding the booster recommendations, anyone who is 12 years and older can receive that booster. And if you're under 18, you would have received a Pfizer vaccine. That is what is recommended for those who are under 18. And so for those who are 12 and older, they would be getting a Pfizer vaccine and then are recommended for a booster as soon as 5 months after they were fully vaccinated. So we really want to encourage all of those that are in that category to seek that booster so they can have full protection.
Okay, the next question is, how will the free federally funded COVID-19 testing site at Metz Elementary benefit the community further? How many people can it serve each day?
I'll start. As Janet mentioned, we've seen an increased demand over this surge for testing. And so that additional resource from HHS will allow us to test an additional 900 people a day. And so not only are we expanding our capacity, we're also taking some of the heat off of the troopers at APH that have been supporting our community with free testing since the beginning. And Janet, I don't know if you have any other comments to add to that.
I don't. I think you covered it. Thanks.
The next question is, over the past 2 years, has Austin Public Health observed and recorded reinfections? If so, in whom, vaccinated, unvaccinated, or which age groups?
You want to go ahead, Dr. Walks?
I was just going to say that we do have statistics that we actually presented earlier in the week on reinfection rates, and we are seeing more reinfection during this Omicron surge than we have seen in previous surges. And the breakdown of the ages and demographics and so on are available, and we can provide those to you at a later date. But we are seeing more more reinfections right now during this Omicron surge than we have in previous surges. And that just goes to the point that natural immunity does not provide the same kind of protection as having vaccine primary series and booster doses of vaccine to have better protection from Omicron and other COVID variants.
The next question asks, what is the difference in treating pediatric COVID cases, and how is hospital staffing holding up?
I'd like Dr. Hauger to take that question.
Thank you, Dr. Walks. The difference in treating children with COVID infection in hospital when they're sick. And a lot of it is similar, which is oxygen and delivering oxygen, maintaining their respiratory status. But the therapeutics sometimes are different in that not all drugs are available for children. That's one thing. And in regards to staffing, this has been a huge issue in our hospitals system across the nation, really. And for our children's hospital here, it has been a big issue. Many of the folks that are taking care of these patients are either have come down with illness themselves or have illness in the family and have to quarantine for that. And so again, the vaccination status is so important for prevention of disease in folks that are exposed. Thank you.
The next question asks, what are the stats on children in the area that have had COVID and other respiratory viruses at the same time? And this person's wondering specifically for Hispanic children.
Should I take that, Dr. Watts?
You can, yes, go ahead.
Okay. Well, I can speak to what we see in our hospital. We have seen in the winter coming in January, we have seen more evidence of co-infections with other viruses. There have been viruses that are usually circulate during the winter time. There's a virus called metapneumovirus, which has been particularly hard in our community this year, and with co-infection with COVID, causing a lot of wheezing and respiratory failure. And influenza A has just started to raise its head, not quite where we were before, but we have seen that. In regards to the presentation in the Hispanic community, I know our hospital serves the Hispanic community, well, it serves the entire community, but we do have a large component of our children that are admitted who identify as that in their ethnicity. And I think it's fairly equal in regards to the admissions for COVID. I don't have the data. We can specifics to numbers, but we can certainly try to get that if that's necessary. But I'm going to say it's fairly equal to what we're seeing for general admissions into adult children's in regards to ethnicity. Thank you.
Thank you. The next question was touched on during the remarks, but it asks, how concerned should we be with the latest variant, BA2?
We remain vigilant and need to remain vigilant with regards to COVID. This new variant spreads more quickly, and because of that, we're going to see an impact on the general population appear more quickly, and it's going to find the vulnerable. And in this case, it's going to find those who are unvaccinated or unable to be vaccinated, particularly those that are under age 5 and the elderly. And one thing to note is that we've seen 100% household transmission. So if a young individual or school child comes home with COVID and there is one of the family members who's vulnerable to COVID, an elderly individual or someone who's unable to be vaccinated, and we know they're going to have that 100% household transmission, then we're going to put those who are unprotected at greater risk for becoming severely ill, requiring hospitalization, and in some instances succumbing to the illness. So it's really important that we continue to get vaccinated, that we continue to mask up when we leave our homes, and wear those masks consistently so we don't bring home COVID to our loved ones.
And I was just, go ahead.
I was just going to add that, this is a daughter lineage off this Omicron parent variant. So it's basically going to be very similar to the original Omicron variant, BA1. It is, as Dr. Walks mentioned, definitely more transmissible. So we're in a critical point right now as we're coming off this original Omicron peak. there is the possibility that it will overtake the BA1 variant, and as it becomes transmissible in the community, we may see another spike of numbers coming up, but hopefully that will level off. But I think the main important thing here is that we need to be very vigilant and doing all of those things that we've been saying for the last 2 years, as far as like making sure that we're vaccinating, making sure we're masking, so that we can overcome this as well.
And I'll just add, of our 5 to 15-year-old children that are eligible to receive this vaccine, we know that there's still 80,000 of them that have not even received a first dose. And that's really important because they do go to a space every day where there are other folks in school, and that makes them more vulnerable, and then also makes anyone in that household that they come back to vulnerable, and it just compounds the issue of the number of people that could contract COVID-19. That child that doesn't have vaccine that's going to the school, that child comes back home. If they have younger siblings under 5, those kids are vulnerable. If they have older adults that are living in their household, maybe vaccinated but are immune compromised, that makes them more vulnerable. So it's really important to note that the vaccine protects individuals from severe disease, but also protects and helps us to reduce transmission and reduce that infectious period that a person may bring the disease home. So those are some things to really think about as you're making this decision to get your child vaccinated, to get other persons in your families vaccinated, to make that personal choice to get vaccinated, that the impact is not just on you. There are a lot of other people that this could protect. And it really does make an impact on whether or not this virus continues to spread and how it could affect your family and your community.
Piggybacking off of that question, do you believe that we are at the peak of the Omicron wave? What might the next wave or variant of COVID-19 look like, and when might it occur?
I'll go ahead and take that. I think we have plateaued, and we've definitely reached a peak. I think we're on the downhill slide of the epi curve right now. As we mentioned, because this new variant is presenting itself, it has been identified in Texas with 3 cases in the Houston area. The odds are that it is circulating amongst us right now. You know, what they're seeing in the United Kingdom is that people are, as they're coming down off of this Omicron original peak, they are seeing increases from this BA2 variant taking hold over there and overtaking the BA1 variant. So, as I said, because it is extremely transmissible, the possibility is that we could have another blip that goes up that will represent BA2 taking over, but we need to do what we can to kind of flatten that as well.
The next question deals with hospitalizations. It asks, what appears the weekly average for daily COVID-19 hospitalizations is dropping nearly twice as fast as it took to rise over the past 2 weeks. Do we expect the decrease in cases and hospitalizations will continue at the same pace in the next few weeks, or do we think it will plateau soon?
We are anticipating that if we continue to work as a community to manage to stop the spread of Omicron, including the new variant by masking and vaccinations, that we will see a peak in ICU admissions in the first or second week of February and a continued decline over time in hospitalization rates. However, all of that depends on how well we do in continuing our efforts, because if this continues to spread and we have another peak, as Janet just mentioned, then we may see a reversal of our good fortune. So it's really important for us to continue to mask consistently in public spaces and places to get our children and ourselves vaccinated. And for those that are eligible get those booster shots so that we can continue to protect ourselves from becoming sick with Omicron, be it BA1 or BA2, and also to prevent any further mutations of this virus.
Are AISD case numbers, including staff and students, pointing toward the sharp decline seen in other parts of the country?
Could you repeat that question again?
Yes, it has to do with cases in Austin ISD, and it asks, are these staff and student case numbers pointing toward the same sharp decline seen in other parts of the country?
I mean, I think what we're seeing is that, as cases decline, we're seeing Omicron sweeping through school districts and really taking out staff and students. And then at some point, there will be a high level of immunity in that population because everyone will have gotten sick. But yeah, I think the phenomenon is similar to what's being seen elsewhere in the United States and throughout the world.
The next question also has to do with schools, and it asks, did we see a spike in adult COVID this month from school children bringing COVID home? Does anything stand out?
As we mentioned earlier, there's 100% household transmission with this variant because it spreads so rapidly. And so when children are sick and come home and parents stay home to take care of them, they're going to get sick, and ergo there is an extrapolation between, or an association between, the rise in cases. And I think Dr. Hauger has mentioned that too in passing as well, if you want to layer on.
Absolutely. When we take our history of these children that are coming in infected, it's not uncommon that the entire family has been ill, and it's a sequence of things. Yeah.
And I will say anecdotally from our case investigations of these school-age children, we are seeing it sweep through households as well. It supports the trend that's being seen worldwide as far as young children who are school-age getting sick and similar increases in that adult population. I'm going to say probably between 30-39 age range that may also have increases as a result.
Thank you. The next question is, with many people receiving their at-home tests from the federal government, how will we keep track of actual positive cases?
So we are, have always been tasked by the Centers for Disease Control and the Department of State Health Services to keep track of PCR positive laboratory confirmed cases and rapid antigen tests that are performed by the lab. That's the case definition and strict guidance that we follow at Austin Public Health, and that other local health departments follow in the state of Texas. And so we have set up on our website under testing, there's a location where people can report their results in if they would like, right now, so that tab is available for people who wish to report their information in. However, it is not something that we're currently evaluating at this current time. I know lately the Council of State and Territorial Epidemiologists, the Association of State and Local Health Authorities, the American Public Health Laboratory Association, as well as the National Association of City and County Health Officials and the Big Cities Health Coalition, have supported the transition for local health departments and state health departments to move away from doing case investigation and contact tracing, because we have such widespread community transmission at the current time. and to revert our surveillance efforts so that we focus on outbreaks and concerns that are in clusters that may emerge in congregate settings and things like that. So we're waiting to see if CDC and DSHS will make a similar recommendation to local health departments, and we're hoping that's the case. It would then transition our surveillance efforts into a similar model that we follow for influenza surveillance, where we're actually doing sentinel surveillance and looking at what variants are circulating in our community, and when we have the beginning of the season, when the season may end, or those peaks and valleys that we might see. But the goal with such widespread community transmission is to make sure that we are able to squash outbreaks as they appear in specific settings or amongst specific groups of individuals. So we'll see what that how that happens. But
okay, the last submitted question asks, what is the breakdown of pediatric age ranges, such as teenagers, children, toddlers, infants, and newborns, who are infected with COVID-19 in Austin Travis County?
We are seeing, according to what our statistics are showing thus far, about 28%, 30% of the cases are occurring in age groups 0 to 4. For the 12 and older age groups, we're seeing about 40% of our cases are in that age group. And in talking to Dr. Hauger, the presentation of those children to hospital has been a little different during this Omicron surge than in the Delta surge. So I'll pass it to you, Dr. Hauger, to speak more to that.
Yes, to that point, during the Delta surge in the summer, we did not have as many children that were in that younger age group, 0 to 4, admitted. Since January, with this Omicron surge, about 37% of all our admissions are in that age group. So that's a big difference for us.
And so that just goes back to the fact that we have a segment of our population that are unprotected by vaccine at this point and unable to be vaccinated until there is a vaccine approved. And so it's all the more important that those who are able to be vaccinated go and get vaccinated, and those that are able to mask in public places consistently can continue to do so, so that we can protect those who are 0 to 4 who are being more dramatically impacted during the Omicron surge with COVID.
Thank you all so much. Those were all of the media questions submitted today.
And we do want to thank our guest today, Dr. Hauger with Dell Children's Medical Center and Alma School Health Authority, Dr. Desmar Wachs, APH Director Adrian Stirrup, Chief Epidemiologist Janet Pichette, Chief Administrative Officer for Disease Prevention and Health Promotion, Cassie De Leon, and to our pool reporter today. We appreciate you joining us from Community Impact, Claire. Thanks for joining us. Everyone have a great weekend.